Hello, my name is Richard Gervais and I'm a general dentist, and I've been in private practice in Houston, Texas for over 30 years. My practice focuses primarily on restorative and cosmetic dentistry. Approximately 7 years ago, I started the Comprehensive Dental Group of Houston. The idea was to provide my patients with the best specialty and restorative care all in one location in a private practice, non-clinic environment. Now, the concept of one office for total care is not new, but in most cases it's one doctor doing all the procedures. Your general dentist may be doing Invisalign. He or she may be doing endodontics or root canals. They may also be doing oral surgery, periodontal surgery, and placing dental implants and restoring those implants. Although not impossible, it's difficult to master all disciplines. That's why I work with specialists in their respective field, and I focus on the restorative and cosmetics. In a clinic environment, especially these large chain clinics, you will see a specialist, but it's very likely that you could see two different specialists for the same procedure, depending on doctor availability and scheduling. Here at the Comprehensive Dental Group of Houston, we work with one endodontist, Dr. Kevin Samedi, and he does our root canals. And we work with one surgeon, Dr. Ralph Hanna, and he does all of our surgeries and places all of our implants. And together we work as a team. And what that means for the patient is they don't have to go to another office to see a specialist, and I'm always here and available to consult with the specialist during the procedure. I'm making this video today to share with you the journey of one of our patients as he has a dental implant placed to replace a front tooth. Richard has had a crown on his upper right front tooth for over 40 years. The crown was placed as a result of a fall in which he was a young child. At this point, Richard has three options for permanent replacement of his tooth. One, he could have a root canal done on the tooth and a post placed along with a new crown. Because there is no tooth structure left, only a root, we would be totally dependent on the post to hold the new crown in place. The dental prognosis, or likelihood of success, would be poor to very poor. What does that mean? It means that he has a 10 to 15% chance that the tooth with the post and new crown would still be functioning trouble-free in 5 years. Not impossible, but not great odds either. His second choice is to have a permanent bridge placed. This involves placing crowns on the teeth adjacent to the missing tooth. Although a good alternative if either or both teeth need crowns, this is not the case here. Crowning two healthy teeth that don't need crowns in order to place a permanent bridge when there is another option is never a good idea. Neither tooth adjacent to the missing tooth have or need any type of restoration. Therefore, placement of a permanent bridge would be considered a more invasive procedure. Richard's third option is to have the tooth extracted and a dental implant placed. This option would have an excellent prognosis. That means there is a 95% chance that the implant and new crown will be functioning trouble-free in 5 years. Unfortunately, nothing is 100% certain, but 95% is a lot better than 15%. Given these circumstances, Richard has chosen to have the tooth removed and a dental implant placed. Now, the entire process will take 3 months from extraction of the tooth, placement of the implant, and placement of the permanent crown. Many of you have been told that the tooth would need to be extracted, a graft placed, left for 12 to 15 months, then the implant placed and left for 3 months for the osseointegration of the titanium implant to occur, and then the permanent crown could be placed, making the entire process take anywhere from a year to a year and a half to get your permanent crown. In almost all cases, this is not necessary. In fact, in the 10 years that Dr. Hannah and I have worked together and the many, many implants we've placed, I can think of just a very few cases where the implant was not placed at the time of surgery. What that means for you, the patient, is one surgery, tooth extracted, implant placed, not two surgeries a year to a year and a half apart. Here's Richard answering some questions immediately after the surgery, along with some photos of his temporary crown.
Richard just had a dental implant in our office. And Richard, what made you decide to get a dental implant instead of a root canal?
Well, the crown that I had was been on for 40 years, and the tooth actually broke in the crown. So the tooth had broken, and the fact that the tooth could possibly break again, I didn't want to take a chance of doing a root canal and then a short time later come back if the root canal didn't hold and have to do the implant anyway.
Were you a little apprehensive about the treatment?
I don't have going to the dentist high on my list of things to do, so I was apprehensive and somewhat concerned. Anytime you talk about surgery or oral surgery, you do have concerns that something might happen.
Absolutely. So tell us a little bit about the procedure and your experience throughout the procedure.
Well, it was like going to the dentist. We started with the numbing, and then after that, the process went pretty rapidly. I didn't know if we were still extracting a tooth or if we were putting the implant in. So I was very surprised that it went as quickly as it did.
And after you realized it wasn't as difficult as it was, I know it's been about an hour now since you've had your surgery. Are you experiencing any discomfort?
No, there was the local anesthetic that was given, and I haven't taken any pain medication. There's a dull throb I've been putting the ice on, but as far as discomfort, there's nothing that is bothering me that I thought possibly might be happening.
Did you experience any discomfort throughout the procedure?
No, it was just a normal dental visit. I didn't experience anything unusual that I hadn't experienced with a cleaning or a filling, or I've had root canals in the past, and this was, to me, less hurtful. It wasn't as bad as the root canals that I've had in the past.
Good. Well, thank you so much, Richard, for sharing your experience with us.
Well, thank you very much, and I look forward to coming back and getting all my procedures done here.
Is there anything else that you would like to add about your experience?
Well, I knew that something like this, I wanted to go to a dentist that, I felt was going to give me the experience that I needed. And I immediately thought of Dr. Gervais, and he and his staff and Dr. Hannah were perfect, and makes me feel justified for coming here.
Thank you so much, Richard.
Okay, thank you.
We will see Richard at 1 month after surgery, and we will post additional photos and video at that time. I hope you will follow his progress with us. Thank you for your time, and I hope this was in some way informative.